My name is Fatima Akilu. I'm the Executive Director of Neem Foundation. I think currently mental health is a crisis in this country. It's really not addressed properly within the healthcare system. I don't really understand why we give much more priority to physical illness as opposed to mental health when the suffering is real, the numbers are growing by the day, and there is not a systematic, coordinated, funded response to deal with mental illness. And people are dying every day as a result of not being able to access proper mental health care services. So mental health ranges from issues to do with psychological distress, depression, anxiety, trauma, to much more serious issues to do with psychiatric disorders, schizophrenia, manic depression, bipolar. And it's not addressed, and the prevalence is increasing, especially amongst young people. There are many gaps in terms of mental health policy at the moment, where provision within the law for mental health that's part of the National Health Bill, we don't really have a coordinated, systematic mechanism for people to access the care that they need. Service provision is very low. We don't have enough practitioners. Part of the reason is that a lot of parents, in fact, do not encourage their children to study psychology and or psychiatry. So you have a dearth of practitioners at a time when the need is greatest, and we really do not have a dedicated, coordinated national response to what I think is an emergency. Outside of the federal neuropsychiatric centers, there really isn't very much available at a state level. There are lots of people that are working very hard to provide the needed care and support that they need. I'd like to tell people that are suffering from mental illness to not be afraid to reach out when they need help. And I'd like the general population to have a better understanding of what mental health is. A lot of people that suffer mental illness do not come forward because of the stigma associated with it, and I think that's based on a lack of understanding of what people go through. And we have unjustified fear of the mentally ill due to our ignorance of understanding mental health issues. Well, I think we have two main challenges that I can speak of on a personal level. One is the lack of adequate provision. There just are not enough mental health practitioners for people to access. And number two, a lack of understanding of what mental health is. So the health-seeking behavior is not what it should be. A lot of people still suffer in silence because they don't know who to approach. And also the fact that society does not support people in the way that they should that suffer mental illness. So people sometimes are ashamed of admitting that they have a mental health challenge. And people should never ever be in a position where they feel that they had to hide a mental health challenge, because it's no different from having a physical health challenge. Mind over matter.